We wanted to welcome you back to our Keeping Kids Safe series. Today we're going to talk about building resilient communities, which is particularly exciting since we have so many communities across Kansas joining us for this ECHO. With folks from school districts, community mental health centers, FQHCs, libraries, police departments, churches, and other community agencies, we have a really unique opportunity to work together to build a more resilient Kansas. We hope to continue this collaboration after this series, and we've considered connecting you all in smaller community action groups. If you would be interested in that opportunity, please type yes in the chat box, just to give us an idea of what people would be interested in kind of connecting with others in your community who want to work together on this issue. We will send out additional information in our follow-up email as well. So last week, we reviewed tools for screening, risk assessment, and safety planning. We were also grateful to hear one school district's comprehensive plan to keep kids safe. And it was exciting to see your discussions about the strategies your school districts and your communities are using and already have in place. So thank you for sharing that as well. This week, we are excited to learn more about ways to build resilient kids and communities. In addition, we will hear from Headquarters Counseling Center, an amazing resource that provides immediate crisis intervention to support all Kansas kids. So before we begin, I want to review some important tips. If you are new to ECHO, we want to welcome you to this collaborative learning community. Because it's a community, we've asked you to turn on your camera and type your names and where you're from in, and most of you have already done that, so that's wonderful. We want it to really feel like a community. You guys have all done such an amazing job so far of using the chat box to share questions and comments and to kind of share resources with each other. So we really want you to continue that today and continue that collaborative spirit of sharing with each other. We want to encourage people to share questions and cases and resources. We want to remind you to maintain confidentiality at all times since we're all bound by HIPAA and FERPA. After each session, you'll be sent the presentation slides. I know everybody's always wanting those. A link to the recorded video, a resource list, and an evaluation link. And it's very, very important that you complete the evaluation so that you can get credit for your CME, and so that we can continue to improve and that we can share all that evaluation data with our funders so that we can continue to keep providing these services at no cost to you. Lastly, I want to emphasize again that this training is for educational purposes and is not intended to provide clinical services. So we know this topic can be very distressing, and we'll have some staff staying a few minutes extra if needed to debrief. But we also will send out resources and contact lists for your local community mental health centers if you feel like you need additional support. And of course, if you or someone you know is thinking about suicide, please call the National Suicide Hotline at 1-800-273-TALK, and we have somebody here today from that resource. So if there's an urgent need or an urgent threat, please go to your local emergency room as soon as possible. So after those reminders, let's get started with some introductions. While we are introducing our panel, please respond in your chat box by telling us in 10 words or less, what is your community already doing to build resilient kids? So let us know what you guys are already doing to build resilient kids, and we'll get started with introductions. I am Skylar Bellinger, and I am a psychologist here at KU Pediatrics, and I'm facilitating the session. Move on.
My name's Steve Lassen. I'm a pediatric psychologist here at the University of Kansas Medical Center. I provide a wide variety of treatment and assessment services to children and families.
Good afternoon, I'm Evelyn Nelson. I'm also a psychologist here at University of Kansas Medical Center.
My name is Alice Zhang. I'm a postdoctoral fellow working on this project.
Chandra Gordon, I'm a social worker working on the project.
I'm Michelle Udd. I'm a program manager for Telehealth Rocks.
And I'm Robert Stiles, who I'm also a program manager with Telehealth Rocks.
All right, great. So we've seen some good things coming through, partnerships between mental health clinics and school districts, seen lots of partnerships coming through. So I love that idea that, really building those partnerships is how we can really build those resilient communities. Anything else that came through, Chandra, as you were monitoring what people are already doing?
So Tara from Pawnee Mental Health, their community mental health center provides a variety of services, including therapy, community-based services and opening a crisis stabilization unit. Then we have Tabitha as well. She said they have a partnership with the mental health clinic in the school district. And then we also, Dana shared they're working with their local community health center as well as Kansas State University and Fort Riley Behavioral Health for providing mental health services in the school setting. And then also Abby shared that she's unsure at this point what her community is doing in the Saline County community.
Great. Well, it sounds like there's already some really great partnerships going on and some really great things happening. So hopefully we'll give you some additional ideas today and we can kind of continue that work in the future. So I'll turn it over to Dr. Lassen and Dr. Nelson.
Well, thank you. It's great to be with you today, and hopefully this session is very helpful. We want it to be very practical too, and hopefully you come away with some good suggestions, good ideas for how to take some of this information back to your own communities. But we're excited to be able to present on this. It's not typically a topic that we talk enough about, I think, with suicide prevention, but very important. So it's not working. Okay, I'm not able to advance slides. Okay, there we go. So nothing to disclose, and that's us. Okay, so just a few objectives for the few minutes that we have with you. One is to really be able to talk about individual strategies to promote resiliency in preventing youth suicide. Also to share some resiliency strategies around bullying and trauma, which are two known risk factors for suicide in youth. And then also to talk about some community level strategies to promote resiliency. Okay, so is this the question we already asked?
We're gonna do a poll question here.
Okay. So is there a suicide prevention plan in your school district or your community?
I'll give you a few minutes to respond and you'll be able to see the responses on your screen as well.
Are you seeing?
I am seeing the results, yeah, so you can check that out. We have about 70% of you have voted, so we'll give you a few more moments to respond if you haven't had a chance to vote yet. Okay.
So many of you are sharing that you do have a suicide prevention plan in your school district, but very, very few have a community-wide plan in place. And that, I think, is pretty typical probably across the country. We're better in schools than we are in communities generally. So, and then a fair amount of you just really don't know. So we've got some room to improve. So thank you for responding to that. So historically, suicide prevention efforts have really targeted reducing risk in individuals. And we're going to try to move past that today to really talk more preventatively about suicide prevention and not talking as much about reducing risk, but how to promote protective factors that we know will buffer against suicidality. And so again, historically, those protective factors just haven't been as much of a focus. And one way to think about this is from a social ecological framework, where you are able to assess and look at many different levels that impact the individual, both at individual and relationship levels, and then at community and broader societal levels. At each of these levels, there are a number of protective factors that we know reduce suicidal behavior across the spectrum, both in youth and adults. So one of the core concepts when we're talking about all of this is this idea of resilience. The American Psychological Association defined resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. And that's really what we're talking about when we're talking about reducing suicide, is we're wanting to promote this idea of resilience in every individual in the community. And just a couple of reflections on resilience to get us started. First of all, resilience is ordinary. And by that I mean that resilience can be found in many, many individuals. It's not an unusual or extraordinary trait that individuals have. So I think that's the first thing to understand, that there is a lot of resilience for us to build on in our communities. Secondly, resilience doesn't mean that there's no distress or difficulty. In fact, the two co-occur, really. You can't have resilience without some level of difficulty or distress. And so resilience doesn't mean taking all of that away or the absence of those difficulties and stressors. And then consider this, that resilience isn't an all or nothing trait. So it's not something you're either born with or you're not born with. You got it or you don't got it. Resilience can be improved. It can be created in our lives and in the lives of our communities. And so lack of resilience is really a key factor in suicidal behavior. Individuals who engage in suicidal behavior tend to demonstrate a real low level of resilience. So it's an important factor in promoting these protective factors. What are some of those protective factors? We'll go through some of the best known and best researched that we have. One, and first and foremost, is this idea of strong connections across individuals, interpersonal connections, into community connections. We know that individuals who are connected to their communities, they demonstrate more resilience, but they're also less likely to act on suicidal thoughts. The ability to problem solve and resolve conflict in our lives, the ability to manage stress effectively. These are each real key protective factors as it relates to suicide. Individuals who have cultural, religious, or personal beliefs that discourage suicide. And I want to be clear about this. It's not just discouraging suicide and kind of driving it under the surface that we're talking about, but really promoting those personal beliefs in individuals that provide a context for suicide and life generally that can be helpful. A good sense of self, a sense of purpose or meaning in life. And you can see how much of this has to do with community, healthy communities. Healthy communities tend to drive a lot of this. And then more at that community and societal level is the extent to which there are effective and evidence-based interventions and clinical care for a wide variety of mental, physical, and substance abuse disorders. And not only having access, but having pretty easy access to those interventions is really critical. So we're going to focus on increasing these protective factors. We're not going to just talk about decreasing risk factors, as important as that is as well. So where do you begin with this? These are a few ideas for each of us to know how to start this process. First thing that we have to do is really identify stakeholders, those key individuals in our communities that are going to help drive change. Those stakeholders are not only mental health professionals, but from a wide variety of healthcare professions, education, justice, business, law, media, and social welfare areas. And then we have to identify the resources that exist in our communities and our families already. Those are important things to build on, and we each have things that we can build on. I remember several years ago I was doing some work in the Kansas City, Kansas school district. And we went in and we followed this process. We met with the key stakeholders. They were really trying to improve the culture and overall functioning of their schools at the time. And then we identified existing resources. We identified 42 different programs in the Kansas City, Kansas School District. And so that was a huge help to us to begin with, to know that those were things that we could build on. Identifying specific needs in the community. Every community is going to have somewhat different needs, and those really have to be identified and focused on. And then determining how to improve our surveillance. Actually, our surveillance of different aspects of suicide remain suboptimal. And so we need to, especially in our local communities, know how to best monitor suicide rates and different aspects of it to really understand if we're making a difference.
I feel fortunate to talk today. It's been a somewhat difficult week where there's been quite a bit in the news about how younger children, we're seeing an increase in risk of suicide. So I feel really fortunate that Dr. Lassen and I can share some of the message that there are things we can do at the school level and community level, and communities have been successful with that. So I think that's the take home we hope you get from today's presentation. I'm starting with some information about students and families impacted by trauma. Many schools and a growing number of communities are engaged in efforts around trauma-informed care and trauma-informed communities. So building on that is one idea with some of the suicide prevention and promotion of resiliency, because there's much overlap in the goals of both trauma-informed care and suicide prevention. At a local and especially school level, some of that is related to addressing bullying and some of the system-wide anti-bullying campaigns. I know that in our clinics, we see a fair share of folks who are impacted by bullying and then at risk for depression and other behavioral health concerns, as well as at risk for suicide. One thing we would emphasize is really, of course, supporting the victims of bullying, but also realizing that our bully victims are at great risk for suicide concerns. So children who are both being bullied and are bullies themselves, so trying to identify those children and also link them up with identification and remediation. Similarly, many schools and communities are looking at preventing adverse childhood events and some of the negative consequences associated with ACEs. So the graph below shows as you increase ACEs, some of the health, behavioral, and life potential impact of increasing ACEs. And we'll see that with health, suicide attempts are a piece of that risk. So with the strategies you all may already be using to prevent ACEs, those also then help with this suicide prevention efforts. I'm going to first talk some about the CDC's information around preventing suicide, and these are really lofty goals. I hope it gives you an idea of the range of things that can be done to prevent suicide. After we go through some of the really wide array of strategies, we'll talk a little bit about how do you fit that to your own community and what are some of the community engagement strategies to help you. So one is strengthening economic supports. So this is really more suicide prevention at the governmental, business and labor and government level. So strengthening household financial security and housing stability are part of the suicide prevention overall strategies. Another is strengthening access and delivery of suicide care. So this ranges from coverage of behavioral health conditions in health insurance plans, addressing some of the severe provider shortages that we have, and really partnering with our especially behavioral health and primary care and local behavioral health systems to achieve that goal. Looking at safer suicide care through systems change. A third component is creating protective environments. Again, it's fortunate we have so many schools joining in, because that's a real place for success in creating protective environments. So reducing access to lethal means of suicide, looking at organizational policies and culture that promote a healthy environment, and finally looking at community-based policies to reduce excessive alcohol and drug use. And then a fourth strategy is promoting connectedness. So part of that is what we're trying to do with ECHO here today. Other approaches are peer norm programs and community engagement activities. A few other preventing suicide strategies from the CDC include teaching coping and problem-solving skills, both at the individual child level, but then at the parenting level, at the broader community level. This may include social emotional learning programs and parenting skills and family relationship programs. Another is identifying and supporting people at risk. So I believe we touched a little on this last week with gatekeeper training, crisis intervention, treating people who are at risk for suicide, and then treating and preventing reattempts. And then finally, lessening harms and prevention for future risk. And we'll hear more about that next week with post-intervention strategies, and then also safe reporting and messaging about suicide. So that's kind of our big picture. So it's not a one-size-fits-all approach. Every community is going to have strengths and challenges with some of those and other strategies. So we really encourage taking a look at the World Health Organization's community engagement toolkit around preventing suicide. It's really an easy to use blueprint with pre-made handouts and really looking from the beginning and assessing the community's readiness to implement across the many constituents impacted by suicide, and then going through that whole process and then assessing how are we now and how can we continue to improve. We'll send out that toolkit as part of the resources today. So it's really a blueprint for community engagement. I suspect many of you have used a similar process with other concerns, really working through initial engagement, information gathering, surveillance, as Dr. Lassen mentioned, creating a plan, again, across the different systems that are involved with suicide prevention, ongoing mobilization of the media and thoughtful approaches with the media, monitoring and evaluating the action plan and results, and then continuing to improve.
So we're going to move from more broad kind of suggestions to some very, very specific ones. We really wanted to make sure that you came away with some ideas for what you can do. I think that that's really a gap sometimes in our efforts to educate, is we spend a little too much time talking broadly and perhaps too abstractly about things. But so we'll just leave you with a few ideas. So at the individual level, you know, what can you do individually? What can I do personally? Well, the first thing is, since social connectedness is such an important factor in all of this, you can reach out. You can increase your social connectedness as an individual. And we know that there's a kind of contagion effect with that. That is, you reach out and connect, and that causes others to do the same. We're very disconnected as a society at this point in our history, I think. And too many of us, you know, don't even know our neighbors, and we don't get out and connect. And we can start that ball rolling. We can get groups together. We can connect with those around us. We can also model what we hope to see in others and what we know protects us against suicide in a wide range of adverse conditions. That's to model taking care of ourselves, a hopeful outlook, and just kind of a joyful disposition. We've all been around those people who do that, and they're fun to be around. And so the more we can do that, the more we can start to spread some of those factors of being resilient. And then really supporting those who you are around. So think about in your schools, in your clinics, in your own environments, making sure that you're not just connecting with them, but that you're supporting them, and that you know, when challenges come up, that you're able to help them get access to good resources, and just supporting them generally. And then lastly, at the community level. So think about some of these suggestions, and hopefully there can be some action within your own communities relative to these. Think about sponsoring workshops that teach stress reduction skills. In your own areas of work, providing information, promoting information about self-help tools, mobile apps that promote coping. A lot of times individuals just aren't familiar with these things, and we know that if they are familiar with them, then they use them. Offering skill building workshops that focus on community related stressors. So perhaps your community is struggling with a particular issue, perhaps substance use or something else, then that can provide an area of focus for you to not just get together to talk about it, but really to focus on building skills. And so again, in each of our communities, we have these content experts. We have people who can help provide this this kind of education and help. Certainly, as Dr. Nelson mentioned, advocating for a wide variety of things, including greater evidence-based health resources, and then utilizing media resources to spread the message. I might have Dr. Nelson say a little bit more about that. Was that something?
Yeah, so we'll send out with our resources an example. There was a worksheet put out about how to spread the word about Suicide Prevention Month, and it just might generate some extra ideas in your school and community about how the media may be utilized.
Right. I think we have another question. Have you referred anyone to the National Suicide Prevention Lifeline? I'll give you a couple minutes to answer that before Meg starts her presentation.
While everyone's taking a minute to answer that, I wanted to test out and see, can everybody hear me? Okay.
Well, everyone's responding too. I thought of Southeast Kansas. I don't know if anybody's there from Southeast Kansas Community Health Center, but Julie Laverick was telling me us a while back about how like substance use was an issue, and they really just sort of put their heads together as a community, and what they found was that people needed a place to go to do something other than stay home and use or go somewhere. And so they, created a community center with, I'm probably misspeaking, but pool tables and TVs and video games. And I just thought that was a really great example of kind of figuring out, okay, where's the need? And then if you think about that, that's probably addressing substance abuse, but also helping with that social connectedness and, supporting each other through coping skills and things like that. So I thought that was a nice example of that.
Yeah, it's a great example. Okay, should I go ahead and get started?
Yes.
Okay, so it looks like 41% of you answered yes, that you've referred somebody to the National Suicide Prevention Lifeline, and 59% said no. I'm really impressed that 41% have referred somebody to the Lifeline. It's a great resource, and I'll talk more about why that is too. But if you want to go ahead and switch it to the next slide. So my name's Meg Fowler, and I'm from the Kansas Suicide Prevention Resource Center, which is housed in Headquarters Counseling Center in Lawrence. If you want to go to the next slide, it'll break it down a little bit. So Headquarters has been open for 50 years this year. And we've been doing crisis work since then. We're really proud to say that we've been open 24/7 for 50 years now. So it's a big accomplishment. And we've been answering the National Suicide Prevention Lifeline since it was a thing, since it was designed. So we have a lot of experience with talking with individuals who are thinking about suicide or worried about somebody else who may be thinking about suicide, along with many other mental health issues or just general life concerns. We also have a student clinic that's open from August to April, and that clinic is a way for graduate students who are either in a psychology program or a master's of social work program to begin their journey as therapists. And we do that for a suggested $10 donation, so it's really accessible for folks to get some services. And then we also just recently started answering chats through the Lifeline. So it's like instant message chat. If somebody maybe doesn't want to make a call, they're able to send a message in and get counseling that way. And then we also have the Kansas Suicide Prevention Resource Center, which is the department that I work for. And we go out into the community across Kansas and provide technical trainings and other educational opportunities surrounding crisis intervention and suicide intervention and prevention. So we kind of have we do a lot surrounding crisis. All right, if you want to advance to the next slide.
And Meg, we had a question. Is the messaging free, the messaging service?
Yes, it is. It's free and confidential. And so is if you call the hotline, it's also free and confidential. So this map kind of just is used as an example to show that headquarters answers the National Suicide Prevention Lifeline for the entire state of Kansas. So if you're in the central part of the state, the western part of the state, no matter where you're at, if you have a Kansas area code, it will be routed directly to headquarters. The reason that that's so great is because we have a really deeper knowledge of the resources that are in Kansas communities and kind of have an understanding of what's available within Kansas communities. I will say that if you call and you have a Kansas number and we are on the phones and we can't get to that call, it will roll over to another center that is not in Kansas. So that isn't, that is one thing to keep in mind, but the good part about that is that no call should go unanswered. So if you're making a call to the hotline, somebody will be on the other end of that. We also have what's the center in Wichita? In Sedgwick County, ComCare, answers the hotline as well for Sedgwick County, but we answer for the whole state. So we do get some help there too. Does that make sense? Does anyone have questions about how the hotline works? I know sometimes that can be the hesitation with referring people, is not really knowing what to expect. If anyone has any further questions, just send it in and we can get to it. But if you want to advance to the next slide. So my portion of the presentation is kind of covering a few different areas. The Federal Communications Commission is trying to develop a 3-digit code that would act as like 911, but to connect you to the National Suicide Prevention Lifeline. So if you were in a crisis, that 1-800 number can be really hard to remember, and it can be kind of tedious to Google it if you're in the midst of a crisis, right? So they're trying to pass through legislation a 3-digit code that would work similarly as 911, but it would be 988, and it would link to the local National Suicide Prevention Lifeline Center. So it'd make it easier for people who are in crisis or worried about somebody in crisis to access, the help that they need or get some guidance on what to do next. So this is a really exciting piece of legislation that we're looking at, but it does mean that it would likely increase our call volumes, which also means that we are doing work on the back end to try to make sure that we would be able to handle that increase in calls. So it's really exciting, but it's also, we're really working hard here to prepare for that, which is likely to pass in 2020. So if you want to progress to the next slide or slides.
So there was another question as well, Meg, regarding the ability to get posters or cards that can be posted around in the school setting. So how would they just contact you at the center to get those materials?
Yeah, sure. You can definitely contact me, and I could hook you up with the way that you could get those. It really depends on what specifically you're looking for. So I don't think my email address is on there, but I can share it at the end too, so that people know.
But that new number is like, you can't call 988 yet. Is that
No.
Okay.
Correct. You cannot call 988 yet.
And do we know the timeline for that rollout? Someone asked.
We're not sure. It's looking like it'll be sometime in 2020. I mean, it could be summer, but it could also be sooner. It's really up in the air at this point. Unfortunately, I don't have much more information about it. Okay, so if you want to go ahead and progress, there you go. So as the other presentation shared, there's a lot of programs that can be implemented. And so I thought it would be helpful to share youth-specific resources that can be, I'm distracted by the comments, I'm sorry. I'm gonna close out of it. So I thought it would be helpful to have an idea of some like hands-on things that folks can implement in schools or coalitions or youth groups and things like that. This is often one of the biggest questions that we get when we go out and do presentations and trainings is like, what are the tactile things that we can be doing with youth right now? And so I am gonna share 3 different resources, and they all vary in cost. So I wanted to start by sharing Erica's Lighthouse, a beacon for hope. This resource is free. It's really easy to use. It really walks you through exactly what you can do with youth. So as you can see, I've put can you all see my mouse moving here or no?
No.
Oh, it's okay. So I put a screenshot of what the main page looks like so that when you go to it, you don't feel confused, because I know it can be overwhelming. Where do you start? Where do you begin? So I thought this would be a great way to kind of show you how it works. So as you can see at the top, it says educators, teens, parents. So those are 3 different portals that you can create an account for, depending on whether you're an educator, teen, or parent. And it'll give you videos and toolkits and reading and all of these things to kind of help guide your conversations with youth, so that you can work with them in educating them about depression, anxiety, suicide prevention, and all of that. So there are resources in Erica's Lighthouse for teens, but it also really empowers teens to learn to help themselves and to learn to help others and their peers by raising awareness, raising attention, and encouraging them to raise their voices as well. So I don't know if I mentioned it's free, so it's a great resource for anybody who's interested in prevention work or intervention work. All right, next slide. So More Than Sad is another program. This one is not free. It's a $60 fee, and then that includes a 26-minute video and then some other facilitator tools for teachers or whoever's going to be implementing the program. So it helps teens to be able to recognize signs and symptoms of depression and other mental health concerns, but also recognizing it in other people. So it's not just focusing on them, but we know that peers are more comfortable talking with one another. And so it really helps kind of bolster that comfort level in youth to be able to have these conversations. And then it also encourages youth and teenagers to be more willing to seek help if they're depressed or if they're worried about a friend. Because we also know that although peers or youth are more comfortable talking to their peers, we know that it's a heavy weight to carry when you're worried about somebody else. And so it also really encourages a safe adult relationship so that youth are willing to reach out for help and ask for guidance and things like that. Next slide, please. And then Sources of Strength is another really good program. What I'll say about Sources of Strength is that it is far from free. So it is about $4,000 to train the trainer. And or it's $2,500 if you're going to send per person if you're having multiple people go. So this is also encouraging a peer connection, and it really works to increase help-seeking behaviors in youth, and promotes connections between peers and teaches peers how to kind of handle that information when they learn about a friend being depressed or thinking about suicide, and also kind of gives them the tools and the resources if they're also struggling with some thoughts of suicide or mental health issues as well. So all of these programs are great to implement if you're looking at increasing peer connection in a healthy and safe way, but it also utilizes the role of a safe adult so that these youth are being supervised and have support on the back end as well, so that they're able to get the help that they need, but also encourage others to get help as well. Okay, next slide. I think it's so these are just some great crisis resources. So obviously if someone is in immediate danger, 911 is always an option. I will say that when, our counselors on the hotline, generally calling 911 is our last resort, right? Because we know that that can be really traumatizing for people. It can be really triggering for people. And so we really encourage our counselors to use their de-escalation and counseling skills in order to keep somebody safe for now. But we do have to use it if we feel worried that somebody is a danger to themselves or somebody else right away. The National Suicide Prevention Lifeline is a great resource for anybody. You don't have to be suicidal to call. If you're worried about somebody else, you can call and talk that through and process it, and we can kind of help you brainstorm ways to have a conversation. We can also talk to people who've just had a bad day, right? So it's not all about these really big crises. It can be just, providing some support. And then we have the direct number for Headquarters Counseling Center. That will automatically direct you to our counseling center. So that's a great way to get in touch directly with headquarters. We're located in Lawrence, Kansas. So if we're near your area, we love to help provide resources and help people find a way to stay safe. Then there's also the crisis text line, which is also free. So if you text 741-741, you can text the word Kansas, and then someone will get to you via text. That's a great way to get some help and support in a more kind of low-key, discreet way. The Trevor Project is a great resource for the LGBTQ community, specifically for youth. So they can talk about any sort of trans or queer issues, including suicide. And then the online chat, there's the website for that. And then we have other resources for safety planning and just lots of other things related to suicide intervention and prevention on our Kansas Suicide Prevention Resource Center website. So that is all that I have. Are there any questions that we should go through?
There were some questions that came up during the presentation for her.
So there was a question in regards to, are you familiar with the Jason Foundation and Jamie Hancock, sorry, I'm voice hoarse, that they provide free lessons and DVDs?
Is this the Jason Flatt Foundation?
Somebody's saying that, yes.
Okay. Yes, I'm familiar with the Jason Flatt Foundation. They passed legislation that made schools in Kansas are required to do 1 hour of suicide prevention training per school year. So I believe that's the DVD or the video that Jamie is referring to. And it's a great resource. We've also gone out and done some trainings for the schools for that Jason Flatt legislation piece as well.
Another question is, does it matter what word you text when you text the number?
I don't think it matters. I think that they say to use the word Kansas so that they can take a tally of where these texts are coming from to gather data.
And then there's a general question for the group, which we haven't talked about in any of our sessions so far, about the impact of 13 Reasons Why and sort of input, if anyone has any input on that.
stop sharing so they can be, yeah, that, whoever has comments on that would be appreciated.
13 Reasons Why is a big conversation in our office. We all sort of fight about who has to watch it so that we, you know, can be up to date on what's going on in there. We certainly don't feel that it's a really a safe show. It really glamorizes suicide and, you know, sort of contributes to that stigma as well. And it's a hard conversation to have because, you know, talking about suicide openly is safe generally if it's done the right way and protective. So it's, you know, if the show were done in a way that, you know, really fostered that like healing piece and that asking for help piece and all of that, I think it could have been more beneficial than what it is now. I know that they recently took out the main suicide scene, which is a big step, I suppose. Ultimately, we're not the biggest fans of that show in our office.
I think it speaks too to what Dr. Nelson was talking about with responsible media coverage. You know, the media can do a lot to help or hinder us in this effort, and I think we all need to be doing what we can to influence media outlets to responsibly and appropriately report on these kinds of issues. I know that beginning of the second season, I believe Netflix put out a kind of short promotional video or a kind of a warning of sorts to respond to the backlash that they were getting from, you know, mental health community throughout the country about this show. Anyway, I watched that, and I think for me it tended to probably pique adolescents' interest more than anything to watch it. I don't think it did much to really reduce adolescents, especially those at risk, for watching it, but tended to just make them more interested in what this was all about. So I think it was a huge missed opportunity, but again, I think it just highlights the opportunity that we have to really make changes and to help guide those conversations and how media illustrates these things.
I think
I was just gonna say, if you had a parent that was asking, what should I do if my teenager wants to watch this? Would you, you know, suggest that they say, you know, completely restrict it or watch it together and have conversations about it, or what would you recommend?
that was going to be part of, I think that's a great idea. I think for overall resilience, as we've been talking about, encouraging parents to watch, of course, this, but other programming with their child so they really can introduce some of the more positive messages. I think that's true for media like this, but also sometimes there's some well-meaning things that come in plays and in more local events. So really pulling in behavioral health and primary care and schools, all working together on some of that planning to make sure it is more the messaging that we're wanting to send to parents and teens.
Thank you. And I think another thing that really came up that I think would be a good conversation to have as a group is, you know, I feel like we always say self-care and take care of yourself, but what is, you know, what does that mean? And do you think some of us could share some, you know, real concrete things that could look like with the group?
Well, I think we're familiar with many of these, but many of us don't engage in them either. We recommend them to everybody else except ourselves. But certainly things like adequate sleep and good nutrition, some physical activity every day, those are like lifestyle self-care habits that just really have a huge benefit in the long term. And so I think those are things to promote, as well as, you know, adopting good, effective coping strategies, staying connected with people, and those kinds of things come to mind for me in terms of coping.
Yeah, I think that a lot of times when we hear self-care, we think of, you know, spa day and pedicures and that kind of thing, but really self-care can be as simple as drinking water, right? And having open conversations and open dialogues with children about where they're at mentally that day or emotionally, right? And kind of modeling, as you guys talked about, modeling good self-care. And that can be some transparency with mental health, right? And there is a boundary. We don't want to overshare with our kids and with youth, but showing that it's the human experience to struggle sometimes, and that it's okay. And the best way to take care of yourself can be starting to just talk about it and finding a safe person to do that with. So those conversations can be considered self-care too. And
I love that.
Therapy and, you know, things like that. I think that those can be an absolute necessity for self-care plans.
I love that. And if anyone else has great little ideas or tips that they like to share with the families or kids that they work with or that they like to do for themselves, like please chat that out in the chat box, even if it's just like shoot hoops or whatever. And then I know that Chandra, our social worker on our team, has a great like ABC coping skill sheet that kind of, do you want to explain that a little bit? And we can share that. We can send that out too.
So basically, and just call it the ABCs of wellness, and it's just a resource list of different things using the first letter of the alphabet that are actually action items or action activities of action. So it could be as simple as journaling. It could be taking a walk. You know, just really looking at the little things that we can do that don't necessarily take a full day. It could just take a moment. And again, just an ability to just give it a chance to reground, refocus if need be. So that will be a resource that will be included in the presentation along with today's presentation.
Yeah, and with every letter of the alphabet, it has several ideas, like 10 to 20 ideas of that start with A, start with B, and then there's even a little worksheet that you can give to families and kids that, you know, okay, pick, you know, one from each letter that you would like to try, like B for bubble bath or, you know, something like that. So I think just giving people real tools, because they're easy, silly things, but sometimes we don't think about all of those things, and different people obviously I think need different types of different things are going to work for different people. So
can I add one more thing? I'm sorry I keep interjecting.
No, please.
But something else that's really helpful too, and that ABC idea really reminded me of this, I love that idea, is creating a safety plan can be a self-care activity. A lot of times people don't think about a safety plan until they're in the midst of a crisis. And generally when you're in a crisis, it can be hard to access in your brain the things that bring you peace, right? Or people that you feel connected to. So a self-care activity that you can do one day with youth could be, let's think about the internal coping skills that you have and make a list of those, and then external coping skills, and then people that you can reach out to and professionals that you can call, and kind of develop this safety plan that they can hang on their wall or in their locker or on the fridge, so that they can refer back to that if they're in the middle of an emotional crisis where they can't, you know, seem to calm down.
I would also add, just kind of adding also with what Meg is sharing, is again another way of also helping you to be able to understand when we talk about coping skills. It's just reframing it and actually putting a human side to it. It's just life skills. So again, just the way that we're learning math and all the other subjects that we're learning in school, these are just tools that we'll use for life that helps us to manage our emotional and social health too. So I think when we give that human side of the fact that we go through a lot of different feelings and emotions on a regular basis, how do we begin to just really look at it from the human experience and not have it more looked at as a mental health or some type of other disorder or a major concern? And so that also begins to help open the door for discussion.
It's great also building on what you just said to see folks are really sharing great ideas in the chat. Catherine shared a meditation chime app. Others are sharing great books and other resources. So we'll send out that chat list too.
And there was another question for you, Meg, as well. And the question was wondering if there are other language lines available for the chat or the hotline if needed.
Unfortunately, that is,
Well, there's the Spanish National Suicide Prevention Lifeline.
there is a Spanish National Suicide Prevention Lifeline option, but otherwise I think that's the only other language and that's the only format that it's offered in, unfortunately.
There were also some good comments about how devices, technology is driving some of the social isolation that we're seeing that is clearly a risk factor. And so in the context of our discussion today, having discussions about how to manage technology in our lives, how to set boundaries and limits, how it can serve us instead of it, controlling us, I think are all great discussions to have, and individual strategies for us to work on ourselves.
Because they don't necessarily think it's the device, but how it's used, right? And there are really positive apps and positive ways, maybe text a friend 3 good things that happened to you today, or so, so there's definitely ways that I think you can use it, but it's just really helping support and guide that process, probably.
Yeah.
So
especially with kids who are learning how to use all of that.
Absolutely. Very closely monitored, right? This is great, and I'm just seeing lots of different kind of ideas for solution-focused brief therapy, and different resources that people are using out there. So we'll definitely share out these comments, and if there's any questions that we haven't got to, we'll try to get to those and answer those in our email coming up. And it looks like we sent out the the Spanish hotline number. So hopefully we've gotten to most of your questions, and we just really appreciate everybody's participation today. We're out of time, but we want you to join us next week when we're going to talk about hospitalization and follow-up. And we're going to hear a case example from, oops, our timer is off, telling us that it's time to be done. But we're going to hear a case example from Southeast Kansas Community Health Center as well. So we're looking forward to that. And before you sign off, please share in the chat box one way that you'll try to build resilience in your community in the future. So if you guys could chat that in for us, that would be wonderful. And we'll try to share these, your self-care strategies and the ways that you're going to move forward in building resilience with the rest of the group. So we look forward to seeing you next week, and we hope you have a great weekend and a great week.
Thank you. Take care.